Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series, which can be heard on VHHA.com, Apple Podcasts, Spotify, and wherever you get podcasts. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, the NYC Podcast Network, and the Family Podcast Network. And we're on the radio each Saturday at noon and Sunday at 10 a.m. on 100.5 FM, 92.7 FM, 107.7 FM, and 8:20 a.m. across Central Virginia and 16:50 a.m. in Hampton Roads, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send any questions, comments, or feedback to pcfpodcast@vhha.com. That's pcfpodcast@vhha.com. Today, we're excited to be joined by Carol Olson, Assistant Director of Injury and Violence Prevention over Gender and IPV Initiatives at VCU Health, for a conversation about her background, the work of the Injury and Violence Prevention Program at VCU Health, and more. With that, welcome to the program, Carol. Thanks for being with us.
Oh, thank you so much for inviting me.
Well, thanks again for being with us. So let's start by getting to know you a little better. In your current role, you are the Assistant Director of Injury and Violence Prevention over Gender and Intimate Partner Violence Initiatives at VCU Health. Your past experience includes work with the Richmond Behavioral Health Authority, the Virginia Sexual and Domestic Violence Action Alliance, at a residential facility for survivors of IPV, and as a leader and program host with a nonprofit radio station in Richmond, among other roles. I imagine that doesn't begin to do you justice. So what would you like our audience to know about you, your background, and your work?
Someone who's probably wore multiple career paths at the same time. So I feel like my work as an art therapist and a therapist in Virginia, when I've lived elsewhere in other states, brought me closer to the world of anti-violence advocacy. And that work then led me into radio. And so I really have combined using radio as a voice to bring cause areas like intimate partner violence, domestic violence, sexual assault, and stalking to the airwaves and bring survivor voices with me. And then I have worked really both with patients in a very patient-focused way, and I've also worked in administration and in development. So a lot of different ways to help the cause area.
Awesome. And that kind of ties into my next question. So from what I gather, you have a strong background in the arts and creative forms of communication, which, like you mentioned, your work as a radio host, which is focused on programming around anti-violence education, mental health and trauma recovery, and women in leadership. Certainly, it's well documented that art and music can be therapeutic. I wonder if you can discuss your background in the arts and to what extent it might intersect with your patient-focused work.
I started out as an artist, a painter, and working in sculpture and clay, and that led me into art therapy as a career because I wanted to be able to pay my bills. But it was a great blend of helping people, and art is a great therapeutic modality to work with anyone, but it can especially be effective in working with survivors of trauma. Working for children, using art can help you work through the metaphor, and it opens up a sort of an inner language that can escape some of the censorship that just, being in our world can impose on us. So art can open avenues for communication for someone to express the things they can't express verbally. And it can be a great healing tool. And really, that art led me to a lot of different things like radio. And then my work in therapy led me all the way to VCU eventually. So to me, I feel like a lot of things are all very connected, and that art and creative modalities, as well as music and dance and other creative modalities, are a great way to help people heal from trauma and other aspects of dealing with mental health.
And as we noted, you're the Assistant Director of Injury and Violence Prevention over Gender and IPV Initiatives at VCU Health. We should disclose here that grant funding flows through the VHHA Foundation to fund hospital-based violence intervention programs at several hospitals, including VCU Health, where initiatives such as Bridging the Gap, Project Empower, and IVPP counseling programs exist. VCU Health, in fact, was an early leader in this space. We've spoken to folks affiliated with this work at VCU and other hospitals on previous podcast episodes. Since you're obviously close to this work, I'd love to hear your perspective about the value and importance of this work to the people you assist.
I think it's incredibly important, and that's why I came to VCU. I have worked in advocacy out in community centers for a long time, developing community-led programs, leading a rape crisis center and sexual domestic violence shelter. And we spent so much time working with law enforcement and prosecutors and lawmakers to change laws and improve access through the legal system. I think we left the health system behind in expecting that maybe they knew it. And so I think hospital-based programs are so important because the research that we're doing at VCU is showing us that improving screening of patients coming into the hospital and using an evidence-based tool is far more effective in being able to identify someone who is either currently being affected by intimate partner violence or sexual assault, or has had it in their life and still needs services for it. And having an evidence-based question and well-trained people to respond makes it easier for survivors to be able to, come forth and disclose if violence is happening to them. And the efforts by having a better trained healthcare system is to reduce repeated re-injuries. We know that survivors of domestic and intimate partner violence often take, 7 times to leave their abuser, which means multiple times they come into a hospital system or healthcare system with injuries. And so having a better trained staff at the beginning, at the first visit, could intervene and intercede in hopefully reducing re-injury. So I feel like it is a game changer, and it's something we should spend more time on, actually.
And in recent years, it seems that there has been more public discourse about interpersonal forms of abuse, assault, and mistreatment, but people who experience these forms of trauma, whether it is domestic violence, intimate partner violence, sexual assault, or human trafficking, may still face stigmas and for any number of circumstantial reasons may have difficulty coming forward or identifying resources for help. What message of encouragement would you offer to someone who may be trying to escape an abusive or exploitive situation?
I feel like finding a safe person to talk to always helps. Most people, talk to their friends or family members. There are numerous services online that can also help you. The Sexual and Domestic Violence Action Alliance has a phone number and a chat line that, so you can use a chat if you need to be quiet. But I find reaching out to some of the systems that are in place that can help provide you with accurate information. So it's always helpful to talk to somebody, like a friend or family member, for emotional support. I would access your local sexual domestic violence center, who will have the most updated information on legal resources for you. They can provide you with means to prepare yourself to leave if you need to leave, and how to do it safely. And we say that preparation needs to be had because we know that violence increases when a person is attempting to leave, and survivors are more often injured or killed when they're attempting to leave. So talking through with someone a plan to make that change in your life would be very important, and having the resources available so that you can immediately move into a shelter system or other secure housing.
If someone listening to this needs support services or knows someone who does, how might they get in touch with folks like you and your colleagues at VCU Health who are engaged in this important work?
In the VCU healthcare system, you can reach Project Empower at 804-628-3361, or you can email projectempower@vcuhealth.org.
Thank you so much again for being with us today. Before we let you go, we do have a tradition on the Patients Come First podcast to ask our guest a pair of personal questions to give listeners a sense of who you are beyond the work you do. To keep things interesting, we've got a list of 10 mystery questions, so please choose 2 numbers between 1 and 10, and I'll ask you the corresponding questions.
7.
Number 7. You could choose one superpower to have or any one skill to instantly master. What would it be and why?
Oh my God. What superpower would I want to have, I guess? I would like the ability to bring peace. If that could be a superpower, I would like to be able to bring peace to the world.
That is such a beautiful and altruistic answer. I really love that. And do you want to pick one more number?
3.
Number 3. What is the best piece of advice you ever received, and why does it stick with you?
Always be yourself. I feel like our world tries to move us into being disingenuous and to put up a false persona, but I feel like the times that I have led with my own authenticity, I have been more successful. Sometimes the obstacles are there when you do that, but I felt like staying true to my inner self and finding the people I needed to be with to achieve that has led me to more success in the times that I have not been.
Well, that brings us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are released. And we want to once again thank our guest, Carol Olson, for joining us today. So thank you.
Thank you so much. I look forward to hearing it.